Welcome, dear viewers, to our format today, Natural Medicine. Environmental toxins, wherever we look. But how do we get them out of our cells again? Especially if we have perhaps suffered from years of poisoning in rooms, under working conditions, or in the body by tooth replacement implants. For this I have a great doctor here today, who has used internal medicine and clinical environmental medicine for years, also with over 80 dialysis patients a day. So really, where we can ask ourselves in depth, how do we get the body clean again? And I am very happy that he is here today, Dr. Harald Burgard. Stay tuned. Hello, dear Harald, nice to have you here. So it's a hot topic. These toxins from the body are of course also always my topic. How do I get them out quickly and where do they come from again? And when I'm tired or my muscles don't grow properly, is it because of toxins or something else? How do you see this topic of detoxification? Is it really a relevant factor for the whole society at present?
If we keep in mind that we are potentially exposed to a huge amount of toxins, of about 350,000 different toxins, then it is a relevant topic. That wasn't the case 200 to 250 years ago, before we started industrialization, plastic production, and so on. Now it is of course the case that not everyone becomes clinically ill, because the person is built up differently. So we have a different supply. Depending on whether someone lives in a big city or in the countryside, the amount of toxins you get is different. One is what you absorb, the other is what you excrete. And then there are people who have good detoxifying enzymes, and there are those who are bad. For example, when I think of toxic metals like lead, mercury, arsenic, and so on, we know that we actually only have one enzyme in the body, the exocytogen S-transferase M1, which can excrete it and which is missing in half of humanity. Why? Because the stuff was never there in any free form until we started industrialization. So 300 to 400 years ago there was no aluminum thing taken out of the crust of the earth by electrolysis. That just didn't exist. The body never had to deal with it. You can also see that, for example, the placenta of the mother, the woman who protects the child from the substances in the mother's body, is permeable for toxic metals. Nature never had to hold them back because they weren't there in any free form. That means, if I take in a lot comes in. If I excrete a little, a lot stays in. The mountain grows over time. And then of course there are people who react to things that enter the body genetically normal or very, very strongly. There are 4 levels, 0 to 4. The people who have a genetic inflammation level of 4, they react to pathogens or to toxins, to parfums, or something so intensely that they faint, that they have intense inflammatory reactions, where you normally say when you hear that, hey, come on, he's crazy. But if you know that they are driven up genetically, like when you drive full throttle with your car and the brake is broken, then you also understand how they react. So these things are quite relevant, not for all people, but for a large population group. And above all, what we see for more and more young people. And when you are confronted with these things and a permanent fire in the body is created, then it can not only trigger an acute inflammation, that rarely happens, but chronic inflammation usually occurs, which run under the radar. You don't really notice them. You feel sick. You don't have enough energy. You get weak. The concentration goes down. People have indigestion, whatever. And often don't even realize that there is a chronic inflammation that you can measure, but only if you know your way around it, because the values do not jump into the eye. And especially these chronic inflammations make people sick in the long run.
I just remembered this topic of thyroid. I also had a 25-year-old with thyroid history, Hashimoto, endometriosis, should be operated on. And I say, when you tell me all this, it seems to me as if you have a heavy metal poisoning with amalgam. But it can't be, you're 25. She says, I have everything full of amalgam.
That can very well be. You don't have to take the burden yourself. It's quite like I just said.
In pregnancy,
The placenta, especially for toxic metals, has no withdrawal possibilities. If you are the mother and you have 5, 6, or 10 amalgam fillings in your body for years, then amalgam has stored at some point. And you actually pass that on to the child. We know today from research that the concentration of toxic metals in the mother's body is also present in the child at the same height. And that is of course for a developing body, where the immune system and the nervous system are not yet built up, much more burdensome than for an adult person, who only takes it up at an advanced age.
So if you really know that you want to get pregnant, you should actually do an endospheresis preventively. See what's actually in the body, to really protect the child as far as possible from these toxins during pregnancy.
When a young woman becomes pregnant, it is always excellent if she has been detoxified in any way before, and effectively detoxified, so that the stuff really goes out. Because all these toxins can pass on to the child and can then lead to memory disorders, intestinal disorders, ADS, ADHS, all these things that we know. The children are restless afterwards, they don't grow properly. I have seen patients who come with chronic intestinal inflammation, 14 years old. I thought they would be 7, because all the growth just falls back. And if you treat the people, the children, the adolescents, then they develop quite normally. So the sooner you start to prevent, that's the prevention, the better it is, of course.
Yes, so we could now also resolve all the symptoms. And who tells us, women, that we can heal Hashimoto if we get the toxins out of the body? These are also diseases that we do not immediately treat with a poisoning.
That's right. Hashimoto is not treated in conventional school medicine. You treat the consequences, that is, you replace the thyroid subfunction with L-thyroxine. If someone has iodine deficiency, you give iodine, you observe, and if the thyroid is burned out, then you give as much L-thyroxine as the person needs. The thyroid is a very important organ. And often it is also the case, if an autoimmune disease has given up a playground, then you are looking for another one. That can then be the carcinoma with diabetes or another organ. That's no fun either. And you can always stop autoimmune disease by eliminating the causes. Professor Fasano was the first to publish that you can heal autoimmune disease by eliminating this trigger. He did it with gluten. He said, I can stop the native spur, the gluten intolerance, which is genetically conditioned. I can stop it by just letting gluten go. And we have seen for years, we can get autoimmune diseases in various ways by eliminating the causes. This is not one, this is a mix of toxins, of toxic metals, but you can always prove in blood that the antibodies that were then formed, that they go back when I have taken out sufficient amounts of toxins.
What is your most optimal possibility to really free the body as efficiently and quickly as possible from toxins?
At the beginning there is always the analysis. You always have to know first, what did the person do in his life? What did he work on? Where did he stop? Which toxins was he exposed to? So that you can get an idea where the number comes from. Then you have to examine the person and see how far physical damage is there. Is that a metabolic problem or are organs actually already broken? If the thyroid is destroyed, I can't do anything about it either. I can prevent the process from progressing. And the body also has a certain regeneration ability. So things can also improve again. But a thyroid that is burned out, which is broken, it stays. The sooner you get in, the better it is. On the one hand, you have to look what's going on. Then you look at the supply. Does the person have enough minerals and vitamins so that the metabolism can detoxify? Does he have enough glutation? Does he have all these things he needs? Then you take the right detox steps. This can be a cellular therapy if there are mainly metals. But it can also go to a toxophoresis, where I take out environmental toxins from the body through a blood wash. In a form that didn't exist until a few years ago. But today we have the possibility to remove toxins, also the immune antibodies, sometimes also Borrelia, toxins from bacteria, from fungi, etc. always with the goal to detoxify the body so far that the immune system gets air again, that an immune balance can arise again, that an immune tolerance can arise again, and the body can heal.
Can you confirm that when people have a high heavy metal load, they suffer more from intestinal fungi, or that Borrelia in combination with these heavy metals are super aggressive? And if I take this parasite, let's say the nutrient or the coupling agent, that they simply can't work anymore?
If you have a toxic metal load, the body naturally looks for ways to relieve it. And it does that by leaving fungi and parasites alive. Because fungi and parasites absorb toxic metals. If you then have a mercury load and know that testosterone reinforces this mercury effect, then you also know that men can be more prone to such a problem. If I have other toxic metals in my body and have certain symptoms, then it is simply potentiated. And I can never effectively design a fungus treatment or a parasite treatment so that it stays away permanently as long as I don't remove this toxic metal load from the body. You always have to aim for that. If you want to treat a gut or a fungus, you simply have to look for the causes. Does the person have a permanent swallowing of mercury from amalgam fillings? Does he have other sources? Does he have a high deposit for years? I have to get rid of that so that I can get the gut back on track.
If I have an artificial hip or some screws, do they give something away?
Titanium is measurable. We have never seen that. There is nothing measurable, but there is titanium sensitization. There are fewer people, but there are those who actually react to titanium and then develop inflammation. We have already seen this with implants. We have also seen it very badly with patients. I once saw a patient who had a problem with his foot. He had had a comfort surgery and lost 2 toes because the wound didn't heal. He was even supposed to get his lower leg amputated because the inflammation had risen in the foot and in the lower leg. The colleagues couldn't explain after I examined him. The only possibility I saw was titanium intolerance. I asked the operating professor to send me the screws, the plates. I then had it analyzed. We saw that it was an allergy. He actually removed all these plates and screws and also drilled the holes so that the titanium wasn't contaminated on the bone. Within a week, everything was stopped. The man was able to keep his foot and lower leg.
Does the TNF-alpha rise? Are these inflammation parameters? What do you recognize?
They are different. When inflammation occurs, TNF-alpha is the mother of the cytokine. TNF-alpha often rises, but not always. When TNF-alpha rises, there are a number of inflammatory substances that can also be measured. We always measure such things. When sensitizing to titanium, it is best to do a lymphocyte transformation test, where you can see that your lymphocytes, your white blood cells, which are a subspecies of white blood cells, deal with the titanium. If this is the case, then there is a permanent inflammation that you don't necessarily feel, but which leads to a weakened immune system, a weakened detoxification, a disturbed gut, but also here, titanium can loosen, and so on, so that the implant always has to come out. These chronic inflammations that arise as a result of an intestinal disorder, through such things, through permanent toxins, through permanent irritability, they just have the potential to make you really sick. We have known for years that chronic inflammations can trigger cancer, because a chronic inflammation always leads to the fact that the cancer monitoring cells, these 2 large cell groups, the natural killer cells, the MRC cells, that they are not even formed or they are there, but they are inactive, they sleep. Both lead to the fact that the body cannot defend tumor cells and at some point a tumor can develop. Then vessel calcifications can develop due to these chronic inflammations, with the consequence of heart attack, stroke, and so on. Sugar can develop, because every chronic inflammation always leads to the fact that the adrenal gland releases more cortisol, that is the body's own cortisone. Then the sugar level rises, then the insulin level rises, and we have known for a long time that if insulin is permanently too high, then at some point your body doesn't T-react to it anymore. This is called insulin resistance. Then it comes to the fact that these chronic inflammations disturb the hormones, that they damage the nerves. We have known for a few years that every inflammation in the body also leads to brain inflammation. This also explains to us why we have more and more people who suddenly with Alzheimer's, with multiple sclerosis, with Parkinson's, with attention disorder, concentration disorder, up to depression.
This is a very extensive complex that you can definitely get under control, and can also be proven laboratory chemically. If you look for and eliminate, that's the nice thing about you. You really put a lot of emphasis on laboratory analysis, before and after, and you also brought us some pictures of you, how you can imagine what comes out of such a body. Would you like to go into that?
Yes, we can take a look at that. We talked about the toxopheresis, i.e. the removal of environmental toxins. Here we have a patient. Normally there is only water in this bag, that is white, transparent. What you see here are simply toxins, which we pulled out of the patient. The bag is full, with a dark mass of stuff. This gentleman, we will still hear him today. He had a strong burn in the whole body, and that went away after 2 treatments. Although you don't see a big difference here, he still has a number of other diseases, which were not gone after 2 treatments, but you can see here both eloids, that's what you call it, look pretty much the same. Here we have, for example, very dark tips. Here some metal came out. It came out much more the second time, then it became a little less again, then it became a little more again. This is also an effect that we typically see, that the person does not detoxify a lot at the beginning and then it gets less and less, but that through detoxification depots are sometimes set free, the first time, the 5th time, the 2nd time, whatever, and then suddenly a lot comes out.
Waves of motion, yes.
You can see it even more clearly in another example, that was here, by the way.
But do you always send these stories in the lab?
Exactly, we send them. This is already directed into the water, we don't send it in, but we send these eloids in, which are pure. This is the pure stuff that we take out of the body, and you can already see it here. If you have a normal eloid, it is so light yellow and very clear, like urine when you have drank 2 liters of water.
So if someone is healthy,
and here you see down there a lot of lumps in there, you see real lumps, and in the end it is only quite a few. This is also a patient we heard about in an interview before, who had a toxic polyneuropathy, so nerve damage.
we did that together.
He had a blood pressure disease, and there is a lot of dirt in there. There is foam on the eloid, there are insecticides, phytonutrients coming out. There are real lumps in there that just don't belong there, and we have seen for years, the sicker someone is, the more of this stuff you have in the eloid. Pure eloid, there is no water in there, it is just what we filtered out of the body. This is what we send in, the rest we direct into water. That's why it looks like this in the bags. And it just sinks through the water, the heavier the substance, the more it sinks down. And these dark tips, these are mostly toxic metals, the heavier, the more they sink down, and they often have a relatively dark color.
If I have been working for years in buildings where there was maybe asbestos, or I have been living for years unconsciously in a moldy house, if I am simply aware that I was exposed to toxins, definitely, or worked with glyphosate.
Yes, or used old furniture, or used plastic from the floor, from carpets, which you don't even notice.
Then I can definitely say, come on, I'll do this preventively, that I don't even run into the danger that I start to suffer from any chronic autoimmune diseases at the age of 50, 60, 70, or indefinable pain.
I am a big fan of prevention, because it is always easier to treat something in advance than to have to repair it afterwards. Of course, that is also a question of whether you are sensitized for it. As a human being, you tend to stop doing things until they no longer work. I see that with the gold implantation patients, they usually come when the implantation is upcoming, but they don't come when it starts to hurt. We all know it, we stop doing things until they no longer work. Unfortunately, you do that often. It is better to do it in advance, because then you can avoid many things, which we unfortunately always see again and again. You have patients who come and you do all the examinations, and you see that there is a high risk of getting cancer, heart attack, whatever.
Mhm.
Then you have seen them once, have done everything, and then you don't see them for a long time. Suddenly, after 3, 4, 5 years, they call, and then the disaster happens. Heart attack, stroke, cancer, or whatever. Then, of course, it's alarm, and then you have to do something immediately. You can avoid that. Of course, I can't always predict what will happen to you. I just don't know. But statistically, from the medical point of view, if someone has a chronic inflammation, then this and that can happen with a very high probability. To walk in there with open eyes is not so smart, but it is human.
Ja.
Now I have the luxury that I always have such great doctors with me and am permanently sensitized. If I would come now and say, I'm going to do this apheresis, can you recognize whether it would be necessary to do a second one? Because when I see that it's going down in such a swath, of course, I want to take this swath with me. I actually don't just want this first one. Do you know, can you recognize in a person who doesn't have any complaints, but does it preventively, at the first examination, does it make sense to do more or does it look pretty good?
First of all, you talk to people. We always do a questionnaire of about 17 pages that the patient sends me beforehand. He sends me his old findings. Most patients regularly come with tons of stuff, but one who comes preventively and maybe he doesn't have much, but I look at what's there and then I look for the people, I talk to them and also do a preliminary scan. These are procedures where I can already assess what's going on. Is there a lot to expect? Are the people really sick? Are there certain loads on certain organs? If you then do an apheresis and see, okay, you have the preliminary data, you have laboratory values, of course I also do certain inflammation values with these people and so on to be able to assess what's going on there and have the ELOAD, then I have a relatively large data collection and can already assess, okay, there's nothing big going on now, then I would also say, we always do 2 apheresis in a row. Basically, if I start now from the area outside the cells, i.e., blood, lymphatic system, connective tissue, pulling out the toxins, then it automatically follows, and with the second toxophoresis that you do 2 days later, we always leave a day off so that it can follow. Then I see, there's a lot less coming out now, there's just as much coming out, there's a lot more coming out with one where I already see the second time, there's more coming out, I definitely recommend a third, if it's exactly the same. I usually also recommend it, if it's much less and all values are okay, then I would say, come on, let's see, maybe in 2 years, in 3 years, whatever. But if you already see in advance, okay, there's a lot coming out, then most of the time the laboratory values are conspicuous, that's almost always the case, that correlates very strongly, and then I would always say, we'll do it at least as long as we have the conspicuous inflammation, the metabolic damage, the deviation from the norm until we have it under control.
Now we also had the topic at the beginning, if mothers have amalgam, I could imagine that maybe one or the other mother, maybe also frightened, now sits there and says, oh my God, my child is now, I don't know, 10, but I have complete amalgam in it, I don't want it to still carry in the cells. Now I ask myself, of course, when can I do something like that at all? How many years from now, if I already know, there is already.
So if I want to look at a child, whether it has a toxic metal load, amalgam mainly contains mercury, about 50%, and silver. Silver is not the problem, but children can also have aluminum and other toxins. Many children have a tin load from their clothes, much more than in adults. So if I have the suspicion that the child has something, then of course I don't do a toxophoresis, but first I do an examination. I can also with the smallest children, I do that with 2 and 3-year-olds, with a cup with a solution, see what's going on there, or look in the blood, what kind of metal load do they have, and then lower it. That makes sense if the child is heavily loaded or if he is already sick. We sometimes have 3 or 4-year-olds who come with Hashimoto, or we have small children who come with rheumat. Then of course you always do that. A toxophoresis, I wouldn't do with a small child. That doesn't work. You normally do it from the 14th year of life or from 40 kilos. That's the limit. In some cases you can do it a little earlier, but then you have to have a hard indication. Otherwise there are other procedures to look at and to treat accordingly effectively.
But it is definitely important that the mothers know that exactly these diseases like rheumat and Hashimoto are most likely to lead back to poisoning.
So you always find a high toxic load with either metal or other toxins that are neurotoxic, i.e. if something is wrong in the neurological area. It is different when children or adults come with rheumatoid diseases. They have muscle pain. They usually have a completely different toxic load. They are often loaded with lead, cadmium, and tin, which are pain-releasing toxins. But they also usually have pathogens like toxoplasmosis or borreliosis or chlamydia traumatis and so on.
Can you also see those?
I always look at it. We can only partially reduce these things, you have to treat it differently. So there are different possibilities via chemical and physical measures, via blood laser, via bioresonance, via nosotherapy, via certain natural remedies, cystic thrombosis and whatever, up to antibiotic therapy, which is also needed in rare cases. As a doctor, you always have a broad spectrum with which you want to solve a problem. And as Klinghardt always says, the best combination of chronic diseases is physical with chemical procedures, i.e. either nosotherapy, bioresonance laser light, plus something chemical, cystic thrombosis, deoxychloroquine, or antibiotics, depending on what you have. But there you have a huge range of possibilities that you use from case to case individually. So there is no bar where you say you always do it the same way.
Then I hope that many doctors will watch again. Maybe one or the other. It's a shame, because I also see it in the circle of friends. If there is something with the thyroid, the L-thyroxines are prescribed like Smarties, where I always think, it's a shame.
If the thyroid function decays, I have to replace something. That makes sense. In our medicine, there is the beautiful saying of watchful waiting. We watch and wait, and if something happens, we intervene. If the thyroid gets worse, we give more L-thyroxines. If the heart gets worse, a heart attack threatens, then we do a stent or whatever. You can do all of that, but today you can also prevent and eliminate causes. Many problems that would inevitably arise should be avoided in advance. In my opinion, this makes sense. This is cost saving. This is also an advantage for the general population, because if the health costs decrease, everyone has something. This is always a huge advantage for the individual in terms of quality of life, if he doesn't have to take 5 medicines, but none, or maybe 1, if he can move painlessly, and so on.
Thank you very much, dear Harald, again for the informative show. See you soon, hopefully again.
With pleasure.
Dear viewers, it is important to know how we get all these toxins and environmental toxins out of our bodies. And all the more beautiful that we have such wonderful guests who show us these different possibilities. Thank you very much for watching. Wonderful time and see you soon.